Hello, this is Mahendra Didia. This is an on-demand dynamic supplemental book on liquid formulation that makes learning faster, better, and easier. The book categorizes liquid formulation as solution, suspension, and emulsions. These products are widely used in pharmaceutical, cosmetics, and biotechnology and dermatological fields. The scientific discipline employed in the integrated approach to development of innovative product is the main focus of this book. An integrated approach is used by many innovative pharmaceutical and cosmetic institutions, from selection of excipients to formulation development to lab and commercial scale manufacturing, and it is captured in the book. The modular format is used in the book and is further transformed into theme-focused subject matter related videos so that the reader can access each module independently for their own learning and references. Submodule incorporates embedded videos and illustrative examples that will help the reader visualize the concept without relying excessively on mathematical equation. The first module is Introduction of Liquid Formulations. It has 3 related videos. In this segment, we'll look at classification and nomenclature of liquid dosage forms. From a physico-chemical perspective, we can classify liquids into 2 broad categories: monophasic and biphasic. Monophasic essentially means single phase, biphasic means 2 phases. Examples of monophasics are solutions such as oral solutions, dermatological and cosmetic solutions, sterile solutions, injectable and ophthalmic solutions, and there are many other kinds of solutions that are used in pharmaceutical as well as in cosmetic. The biphasic liquids categorized as emulsions, in which liquid globule and liquid are present. Examples are lotions and creams. Suspensions are solid particles in liquid. Examples are vaccine and antibiotics, and there are many other examples. So liquid formulation solution contains a single phase, i.e. monophasic. One or more chemical substances such as drugs or active ingredient, preservatives, etc. are dissolved in suitable solvents. Suspension contains 2-phase system or biphasic system. Particles are dispersed throughout a liquid phase, and the particles are insoluble in the liquid phase, i.e. solid particles are suspended. Emulsion consists of another biphasic system of 2 or more immiscible liquids. One liquid is dispersed within the other liquid, i.e. external or continuous phase. Again, we'll go into great detail in all 3 different formulations, that is solution, suspension, and emulsion, in this book. The United States Pharmacopoeia, that's an official pharmacopoeia in United States, defines pharmaceutical dosage form, specifically liquid dosage form nomenclature and classification. USP preferred dosage form names are provided in this table. They include creams, emulsion, gel, injection, irrigation solutions, liquids, lotions, ointment, paste, rinses, shampoo, solution, and suspension. Each of them are either biphasic or monophasic, or can be both monophasic as well as biphasic. For example, emulsion would be a biphasic, whereas a solution will be a monophasic. In addition to the preferred dosage form that are described in USP, there are other dosage form terms have been used in the United States Pharmacopoeia current official articles, but they are not preferred and should not be used for the drug product. In addition to that, Food and Drug Administration has a guidance on how to create the name, salt, and preferred dosage form names. Boucher and his co-workers provided a clear understanding of physicochemical properties and its relationship to nomenclature. This provides additional information on how the name or classification is used. It starts with solutes, i.e. solid or liquid. Vehicle is always liquid, and products are a mixture of them. A product is clear and homogeneous, i.e. solutes and or liquids are dissolved completely in the vehicle liquid. It is a solution dosage form. Solids are insoluble and dispersed in liquid vehicle, then it is a suspension. Solutes, which are liquid, immiscible in the vehicle liquid and have low viscosity, they are lotion, and lotions generally will require stabilization by emulsifier. Immiscible mixtures with gelling agent, they increase viscosity and stiffening, and we refer to them as a gel. Immiscible liquids with surfactants with a higher viscosity and stable globule formation are generally defined as a cream. So cream and lotion are emulsion formulations, except the difference being the viscosity. In lotion, it's a low viscosity, and in cream, it has a higher viscosity. Immiscible mixtures containing large amount of solids generally would be considered as a paste. So this provides further understanding of the USP terminology. And again, throughout the book, we will use this terminology. Liquid dosage form pharmaceutical label. Example of nystatin, an antifungal agent. Physicochemical properties, and the final product with 3 different formulations is shown here. It's the same active ingredient at same strength, i.e. 100,000 unit per gram. Nystatin can be a cream formulation as shown here. It could be an ointment formulation as shown here. These two are topical, i.e. cream and ointments are topical dosage form. And nystatin also can be administered as an oral suspension, in this case 100,000 unit per ml, and it needs to be shaken well before administration. In addition to that, pharmaceutical drug require clear labeling. FDA approves that labeling, and classification of the liquid product currently displayed on the container label. Example here is naproxen oral suspension USP, and it clearly states it's a suspension for oral use. Digoxin oral solution clearly states it's an oral solution for oral administration. In addition to that, information such as the strength, 125 milligram per 5 ml for naproxen, and for digoxin, 0.05 milligram per ml is clearly displayed. In comparison to that, cosmetic labels are not required to be approved by FDA. Example here is hyaluronic acid. Product with 2 different configurations are shown. In general, cosmetic labels contain sensory and claims on the product information. For example, hyaluronic acid, 1.5% pure hyaluronic acid serum, and it provides certain claims, i.e. visible plump skin, reduces wrinkles, and it comes with a dropper. Whereas Revitalift is a triple power moisturizer. It appears to be a cream, and again there are sensory and claims included in product information such as reduces wrinkle, firm, brightens. These cosmetic products meet cosmetic labeling guidelines issued by FDA. There is a new law that was enacted by Congress in December 2022, very recently, and FDA regulations are pending.